to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're breaking down some of the most common billing terms, things like premiums, deductibles, copays, and insurance. By the end of this episode, you'll feel more confident reading your medical bills and choosing the right insurance plan. Joining me today is Christine, a member of our team. Welcome, Christine.
Hi, Dr. Borelli. Thank you so much for having me here. So, yeah, let's start with the basics. For sure, a lot of people like me, most of us doesn't know like insurance terminologies or terms. So
Yeah.
we hear the word premium all the time when it comes to, insurance, right?
Yeah.
So what does that actually mean?
That's a really good point because there's a lot of big words or words that are unfamiliar to people. So a very common one is premiums. So a premium is simply the amount your employer, or sometimes both of you, pay every month for your insurance plan. And think of it like a subscription fee. You pay it to keep your coverage active, whether you use your healthcare services or not. So your premium is typically monthly, or sometimes it's like per pay period if you get it through your employer, but it's pretty consistent throughout the policy term.
Right. Okay, so now let's talk about deductibles because that's another term
Yes,
about insurance. I think this one, confuses a lot of people. So how do deductibles work?
you're right. So it's one of the trickiest terms because
Exactly.
it does vary. So a deductible is the amount that you must pay out of pocket before your insurance starts covering your care. And sometimes there's multiple deductibles. So, for example, if your deductible is 2000, you'll pay for your services until you hit that $2,000 mark within that term, which is usually like a year. And then after that, if you meet the 2000, your insurance starts sharing the cost with you based on what was the determined cost sharing policy.
Right. Okay. So that brings us to co-insurance and copays. So people sometimes, mix these two up because, we have like a lot of calls asking this.
Yes.
Can you, explain the difference of copays and co-insurance?
Sure. So a copayment or copay is a fixed dollar amount that you pay at each visit. For instance, like $30 when you see your primary care provider. And so coinsurance is different. Instead of being a set dollar amount, it's a percentage or a certain amount of the bill that you're responsible for. For example, if your plan has a 30% coinsurance, you'll pay 30% of the bill and your insurance will cover the other 70%.
That makes a lot of sense. So here's a term that always gets, people nervous:
Yes.
out of pocket maximum. So some people see a number like 50,000 and they think they will automatically owe that much, right? So is that true or that's a hoax?
No, so out of pocket maximum is like the maximum amount that your insurance can charge you during that plan year or period. So it's the most that you'll ever pay. Most of the time, or at least in many cases, you won't actually reach that number. But depending on your health history and conditions, you may. But that is the amount that beyond that number, your insurance will pay 100%. It's not something that you're required to pay. It's just the ceiling of your cost if you had a very expensive year of care. I kind of think of it as like worst case scenario, what's the most that you're going to pay? So if you're like a keen budgeter, it would sort of be like your worst case scenario of how much you would pay that year for your health insurance.
So now let's get into some real life situations. People ask about, let's say, for example, if I have already met my deductible, why am I still getting bills?
That's a great question. Well, meeting your deductible doesn't mean that you stop paying entirely. You might still owe copays or coinsurance. For instance, if you've met your deductible and you go to see a doctor, you could still owe 20% or 30% of the bill depending on your plan. Now, one thing I want to add is that when you're like looking at different insurance plans, a lot of times your premium will be lower if your deductible is higher, and vice versa. If you have a higher premium, then a lot of times your deductible is lower. So those are things to kind of consider. And it's really an individualized approach based on your health, how often you go to the doctor, and things like that.
Right. Thank you so much for explaining that. So, because
Sure.
I know a lot of people are, has like a follow-up question about that. So I think that's
Mhm.
the answer. So what about this one? I have paid my copay at the doctor's office, but then I got another bill in the mail. Why does that happen?
That's another great question. So, this is actually really common. The copay is just part of what you owe. If you haven't met your deductible yet, you might get billed for the full visit. And if you've already have met your deductible, that extra bill is often your co-insurance portion of the cost. It's definitely tricky to understand, and it may take a couple of times going over this to maybe be a little bit less confusing because like we said, there's a lot of different terminology
Mm-hmm.
here.
Yeah, absolutely. This is amazing, Dr. Varelli. This really clears things up about insurance, and medical billing doesn't feel, quite as intimidating when you understand the terminology.
Exactly. Knowing the difference between words and terms like premiums, deductibles, copays, coinsurance, and out of pocket maximums, that can really save you from a lot of confusion and even help you choose the insurance plan that's right for you. And remember, if you're struggling to understand your bills or pick the best plan, Pathway Patient Advocates is here to help. We can really help you understand and walk you through selections and options for different policies and maybe the best way to utilize your plan.
Very well said, Dr. Varelli. Well, for anyone looking for help for themselves or for their loved ones, there are so many ways to reach out to us. Give us a call at 947-517-8395.
Thank you, Christine. It's been a pleasure, as always. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journeys. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.